Good afternoon, everyone. Today I am in front of Dr. M.K. Mani. Padma Bhushan Dr. M.K. Mani is a legendary nephrologist and established nephrology care in India when there was no such discipline after coming from Australia. He is my teacher and I consider him as my guru, mentor. From Sir, we have learned not only nephrology but principle and ethics to follow as a doctor and as an individual. Like me, many believes whenever we face dilemma in ethical decision making, we think about Dr. Mani sir. Recently, I met Dr. Dinesh Khulla sir in ASN, and he is a senior Delhi-based nephrologist. Also shared the same. He was telling sir that he recalls you and Professor Dr. Samiran Nandi sir. Whenever he gets stuck in clinical, not clinical, mainly ethical decision making, sir. And sir, you have co-authored with Dr. Samiran Nandi sir a book called Healers or Predators. I myself is Dr. Partha Karmakar, SAS student and a Kolkata-based nephrologist. Sir, thank you for accepting this invitation, sir. Dr. Mani sir has taken path-breaking work in the field of preventive nephrology at the community level. Chennai Kidney Trust, established by him, has shown how effectively, with limited resources, at bare minimum expenses, with control of diabetes and hypertension, and therefore kidney disease can be controlled at community level, sir. Central government also taken some steps, like National Health Mission also incorporated this controlling sugar and hypertension at community level. However, I think government of Tamil Nadu has taken bigger steps because they are doing door to door, sir, which is your basically core component of your model. Sir, my question is, what is your comment on preventive nephrology?
Well, obviously, it is the thing that we should do because the cost of treatment of kidney disease is so high. It is very much better to spot it and prevent it, rather than waiting for the patient to go to a stage of dialysis or transplantation.
So that should be the priority for the nephrologist.
Yeah. In particularly in this country, because of the scarcity of resources, when we don't have the money, it is much better. It is better in any society to prevent, but perhaps in societies where transplantation can easily be done at no cost or low cost to the patient,
Yes.
it will never be low cost because always you have to use certain drugs and do certain things, so the cost will be high. But if you got a state subsidized program, then maybe the cost to the patient can be reduced. But any day prevention is better than cure. So always we should try to prevent rather than waiting for the disease and then curing.
Sir, what is your expectation from the central and state governments in prevention of kidney disease in future?
Well, obviously where there is a problem which can affect anybody in the community, it is the responsibility of the government to keep people healthy. But because transplantation is such an expensive proposition, you can't expect that all people who require a transplant will be covered by government. It is all the more important that the government should try to prevent. So the cost of early detection, prevention, slowing down the decline is much less than the cost of doing kidney transplants. So obviously, in any government program, their aim should always be to detect, slow down the progression, and try to keep the patient healthy without having the need for kidney transplantation.
Sir, in one of your article, you have mentioned the cost of free dialysis program. So, do you feel that the prevention should be the priority?
Obviously, because the cost of dialysis is so high, if you devote your funds to keeping patients with kidney failure on dialysis, that means that much less money will be available for treating patients with other diseases. And in that sense, we should, it is vital that you should prevent and not that you should treat after detection, because that will waste a lot of money. So, prevention should be the sole aim.
You have always emphasized on cadaver transplantation, which is the best way to meet organ shortage and curtail commercial kidney transplant. In comparison to global percentage, cadaver transplant in India is low, even though in the past few years there has been an increase in the cadaver organ donation, and but very poor in most of the part of India. So, do you think, sir, that there is a both physicians and administration's inertia played a role for limited success of cadaver transplant program in India?
It applies to both things. One is that people are not in the mindset of making use of the organs. That is not a common approach of people. Most people, you say somebody dies, let us finish all the functions, all the ceremonies, rites quickly, cremate the person or bury the person, whatever it is, quickly and be done with it. Obviously, if you're going to donate the organs, there will be a delay of several hours before all those procedures can be completed. And many people don't want to wait for that. If they would think that that few hours that they have to take extra can mean several years of extra life to so many other people, because all the organs can be utilized, heart, liver, lungs, and kidneys. So the donation can give extra life to so many people, then it should not be a criterion at all. What does it matter? 3-4 hours of your time. It should not matter at all if it's going to mean 10-15 years of extra life to a patient. So that's obviously, we should not, being reluctant to delay a cremation or burial should never occur if it's a question of saving somebody else's life.
And sir, nephrologist and government organization also should be much more proactive, sir.
Yeah, obviously. It doesn't have to be only nephrologists, because cardiac transplant, liver transplants are also life saving, which can be done. So, all the medical professions should be involved in that.
Sir, in very early days, you had established a robust training program in nephrology in a corporate setup, which has been replicated in other parts of the country later. You have produced so many nephrologists. When you see so many students in the field of nephrology playing a significant role, how do you feel? And what are the expectation from them?
Expectation from any doctor is that he should do the maximum that is possible to prevent disease. If somebody gets the disease, to slow down the progression, and if it reaches the end stage, to treat it. That should apply to all fields, not only in nephrology, any field. That is the purpose of medicine, is that to try and keep people healthy and raise the general level of health of the whole population.
Sir, you have always maintained high ethical standards in your long career. However, in the present context, where every aspect of the healthcare has been commercialized, what is your advice to medical fraternity in maintaining a balance between ethics and commercial success?
Commercial success will come. There is no reason for any doctor to hesitate. Ethics is the prime thing, because ethics is determined by the practice of large numbers of people who have laid down certain criteria for everything to be done. And it's our responsibility to follow ethical principles from the beginning to the end. We automatically, if you're doing the right thing ethically, then patients will also benefit. But we should not be saying I sacrifice ethics and do something for the patient. That should not happen, because usually when you're sacrificing ethics, it means that you're concentrating on some rich people who are able to pay for treatment. That should never be a criterion of a doctor. Doctor should not be bothered about the where he is going to get the income from. He should do his job. And if you do your job, no doctor will starve. Every doctor will get enough money to live comfortably. I don't believe that there's going to be any worry about income or how the person lives. The worry should only be that he should do his job properly, and that's all that we should concentrate on.
In your chapter in a book, Healers or Predators has identified the root causes of the corruption in medical profession. Corruption in medical profession has grown proportionately with corruption in society as a whole, both in manner and magnitude. Probably it's the new normal. Now healthcare is an industry, follow robust marketing strategy. One of the pillars is healthcare agents or brokers. Sir, I hail from West Bengal, so I have uh, direct knowledge about how the Bengali agents bring patients to different hospitals in South India and being rewarded by many hospitals and even individual doctors at present day. So I feel it is a part of the systemic corruption. So as your student, sometimes I get confused and sometimes I get stumbled how to maintain ethics as an individual in a healthcare industry which on principle follows some corrupt methods. So your comment on how a doctor can remain ethical in a generalized corrupt system means I seek your overview on individual versus systemic corruption.
We can't be responsible for the system. It is what is happening in the country should not influence what is happening in our practice. We do the right thing. You know what is right, you do the right thing. You need not be crusading about other people, because that is it's a colossal thing, and it will be very difficult in our country. It's good to, if you have got the influence and the ability to devote the time to try to purify the whole profession, but that should not be the main goal, because it is too much for the average person to do. Look after yourself, make sure that you are following the strict rules of ethical practice, and that your patient is the primary interest for you, with financial interest being secondary. That's all that we need to aim for. We need not be trying for more than that. If you can achieve more than that, well and good. But that should not be our prime purpose, because too much energy will get wasted and too much time will get wasted in trying to organize the whole society, which will be beyond the capacity of any normal individual.
In your autobiography, Yamaraja's brother, you reflected on life, death, and the duty of a physician. How have these reflections shaped your approach to a patient care today?
I don't think it has made any difference at all. My job as a doctor is to treat the patient, ideally to try and prevent disease. If you can't prevent, slow down the deterioration and offer the treatment. So it is not my job to try and heal the whole community. I can't do that. Whatever patients I have access to, I should do the best for them. That is all that I aim for.
When treating kidney patients, especially those requiring lifelong management, what qualities do you believe a doctor must cultivate to truly value the patient beyond the disease?
That applies to all disease, it's not only to kidney
Kidney
disease.
disease.
The main thing is that as far as kidney disease is concerned, the treatment is very costly. So you could try to help in trying to reduce the cost and try to help in raising funds. But raising funds, there is always the worry that if you say spend a lakh of rupees for a kidney patient, that lakh of rupees can benefit a large number of other people who are suffering from serious illnesses. And I would not be in favor of diverting money from general medical things to treat only kidney disease or complicated heart disease or something like that.
A great mentor can change a mentee's course of works and life. What is your advice for us, our generation, to be a good mentor?
I don't know. I think that it's the duty of every doctor to do his job. If somebody is there who is taking an example from you, well and good. But it should not be our aim that we should see that everybody does the right thing. That is beyond the scope of one individual doctor. So I do what I am supposed to do. My duty I do. If somebody else chooses to follow it, well and good. But I cannot be going around and saying you're doing the wrong thing, you should do it this way. That is not going to work also, and it will be an unnecessary expenditure of time, which I think is going to be detrimental to your own profession.
Sir, Ayurveda in India is an ancient medical methodology. Central government has formed Ayush for upliftment of indigenous medicine. However, in era of globalization, scientific research is essential for establishment of any medicinal method. Sir, what are your suggestions on blending modern medicines and alternate medicinal method significantly and scientifically for the betterment of humanity and need of research in Ayurveda to establish among scientific community?
Yeah, first of all, I wouldn't call it alternative medicine. Ayurveda is a well established system which is centuries old and has been practiced. The only thing is we should practice it scientifically.
Yes, sir.
We now have methods of evaluating which were not existent, which were not available to the Ayurvedic practitioners of old. So we can now accurately measure what is the degree of a disease. So we can apply a treatment and see how the disease is going. We have got better methods of looking for the toxicity of medicines which are used. So we can apply the monitoring methods of modern medicine to the ancient treatments. And that is a system which a number of people are trying to do. What is wrong is for unqualified people to use something or the other without proper monitoring of what are the effects of that illness. That is something which I think should not be permitted at all.
You started your nephrology career in India long ago when nephrology was in a nascent state. And now Indians like Dr. Praveer Rai Chaudhary, he is an US resident, is American Society of Nephrology president. And Indians like Dr. Vivekananda Jha was in recent time International Society of Nephrology president. How do you feel when Indians are leading the world in nephrology forum?
I don't think it makes any particular difference. We should not think that this is Indian. Any doctor who chooses, many doctors don't choose to go for these societies and presidentship and all that because it takes away from your pure professional time. On the other hand, it is something which is also good. You can be a president of a society or something like that. You can do some good, making the society function better. So that is a possibility. So you have to decide how you allocate your time. And if you choose to do it, then do it. But do it properly. If you don't choose to do it, that gives you more time for the practice of the pure profession itself. Within the profession, whatever time, effort goes into teaching other nephrologists, or whatever time goes into improving the standards of the how to tackle the disease in the community itself, is obviously well worthwhile. So we need to look into that, allocate your time and according to your individual talents, and do what you can.
Sir, In India, so many nephrologists are being produced now. However, in one hand, they are concentrated in the urban area where the health tourism and in health industry is flourishing, and probably in the rural area, the nephrology care or probably all aspect of the healthcare is suffering. So, do you feel that even after producing so many medical graduates, super specialists like nephrologists, the primary healthcare in India is suffering?
No, primary health care is the prime thing which should be done. So, government should concentrate on trying to keep people well. I don't believe that government should go or concentrate large resources on treating a few individual patients. By and large, government resources should be devoted to early detection and prevention of all diseases, not particularly kidney disease, whatever disease. So try to get healthy living, keep people well, and that should be the prime aim of the government.
Sir, we have seen in mythology the Karna and Arjuna and Ravan and Ram. The ones who lost are of great character, both Karna and Ravan. So, in life also, we may see such things and we do see such things. How does it differ that one, both the great character, one loses and one wins?
In medicine, it is not like that. We are not competing against anybody else. In medicine, we are competing against disease.
Sir,
So,
this I am asking in life is not related to
so
medicine, sir.
life itself, obviously, you do the right thing.
Yes.
In all these, in the examples that you have given, it so happened that circumstances meant, for instance, Karnan had unfortunately got a duty to somebody who did not do the right thing. And but he looked at his duty as something that he had to do because of what he was, largely because of the help which he got from Duryodhana. So obviously he will feel that a sense of gratitude, he has to do something for him. When you look at it another way, then obviously he should say, okay, what you're doing is wrong. He should try to persuade Duryodhana that he should not do
Yes.
whatever he is doing. Yes, in practical terms in life, it is not feasible. And obviously, somebody who owes a lot to someone else may feel that he has to do something to help that person. But ideally, we should all look what is the right thing, what is the wrong thing, and we should try to do what is right. And that should be our goal.
Sir, politics or political belief is a part of every citizen. So, of you too, sir. Since British era till now, we are hearing many isms like nationalism, secularism, socialism, etc. Sir, in your long public life, what did you feel the best belief of this to lead our country?
That is a field in which I have no expertise. And fundamentally, what is required is everybody who is doing a political party or an individual, the aim should be to improve the quality of life of every Indian. And that's how what we should approach and try to do the best that we can in that. So, how much time, how much energy you devote to it. Obviously, if somebody goes on devoting a lot of time to improving public health, there'll be less time available for treating individual patients. So each one has to balance according to his interest, according to his ability. You have to balance what you do in your profession.
Sir, many of our seniors and contemporary colleagues are not keen to see their children or relatives as doctors, as they do not enjoy this profession. Sir, hypothetically, in your next birth, do you want to become a doctor again?
I would, yes.
Why, sir?
Because I feel that this is one profession in which you have the opportunity to do good to people at the same time as you're doing your normal professional life and making your living, and we're able to do to benefit other people and benefit yourself. So it doesn't apply only to medicine. There are so many other fields of public service which can be of benefit in the same way. So we can do whichever it is, but if incidentally in your normal profession and making your money, you're also benefiting other people, that's a good thing.
Thank you, sir. Uh, as you have mentioned in the words of Rabindranath Tagore in your book in Healers and Predators, where the mind is without fear and head is held high, into that heaven of freedom, my father led my country away. So, sir, with it, I seek your advice. Few words you tell how to maintain the medical profession much more ethical and enjoyable for our next generations.
What you do for the medical profession itself can only be or can best be solved by doing setting yourself as an example. We're all doctors. We do our job properly. We start first from there. And we do what is right. If you happen to be a teacher, you can also explain the same thing to your students. But there's no point in only teaching the students this is what you should do, this is what you should not do, while you yourself are doing something completely different. So the first thing required is standards should start with ourselves. Whatever is right, we should do. By and large, that is enough because if you're doing it automatically, people who see you, students who see you, will be inspired to do the same thing. It does not require that you should be going on telling them you do this, you do that. So, I believe that ultimately what is required is that each one of us should do the job that we have taken up and should do it correctly, honestly, and make sure that it is done properly. That is, if each Indian would do whatever job he takes up and does it properly, automatically we will become a much better place.
Sir, you said nephrology and kidney transplant is very expensive, and also you said suggested early detection is the ideal thing to control everything. But once the patient is got disease, disease developed, it's why to control the how to control the cost because a lot of the dialysis units are very expensive nowadays. It's little price is reduced. How to control the cost of the treatment for a for a longer duration?
No, controlling because our basic aim should be to try and prevent people from getting into kidney failure.
That is
So that is what we can do something about. Detect early, treat properly, and make sure that uh, the disease does not deteriorate too rapidly.
okay.
Beyond that, what can we do? There's no the cost of already many people are trying to bring down the cost of dialysis, bring down the cost of transplantation. That will go on. Whoever is doing dialysis or transplantation should try to reduce the cost while maintaining the efficiency of the treatment. We can reduce the cost by cutting corners, by not doing things properly, but that should not be the goal. We should do everything correctly so that the patients have their normal or the best possible outcome in their disease, and we try to make it as cheap as possible. So,
Sir, all this question and answer I will share with the society. Thank you, sir. Thanks for your time. Thank you very much. Thank you. Thank you very much.